So robot will replace the doctors in future?
Robots will not replace the doctors, but there will be doctors with the robot and doctors without the robot.
What kind of injuries generally happen?
When you lift weights, you get a lot of shoulder injuries.
You always talk about future is robotics.
I think if you had asked me this question 5 years ago, I would have said yes. I think future is robotic. That future is here now.
Generally, is there any particular age?
You want a surprising fact. Children as young as 5 are deficit in vitamin D.
Hello and welcome everyone to another insightful episode of our podcast session. I am Debaruti. Today we will be discussing on a very important topic in the field of orthopedics, the role of technology and robotics in bone and joint care. It's an honor for me to have with me right now the Director and HOD of Orthopaedics, none other than Dr. Rakesh Rajput. So sir, welcome to this podcast.
Thank you.
So what I would like to know from you firstly that in recent times we have seen that robot is playing a very, very vital role in orthopedics. So why it is like that and how it is adding benefits to both doctor and patients?
Yeah. So Devati, I think let's be one thing very clear. Technology is driving every sector. It's not just medical sector.
That's true.
And even in medical sector, it's not driving just orthopedics. It's driving literally everything. Now you cannot do a radical cancer operations without a robo.
True.
And robo had to come in orthopedics also. And what we have seen with robotics is that, it brings in a lot of other things except just the machine. There are other things, the calculations which go behind it, the permutations, the combinations, you can all do that beforehand. So I think the technology, we should embrace it. Even the senior doctors, I would suggest, should not fear it. They should all embrace it and, go ahead with this. Even at my age, if I can learn, I'm sure the guys younger to me should be able to learn all this.
Absolutely correctly said, so I can understand definitely. So another important aspect of bone health is how it differs across individuals. Is it different for male and female?
Yeah. So I think where bone health is concerned, I think God's been a bit partial. He's given better health to the guys.
Okay.
And for all the benefits which a girl gives because of the birth issues, she does go through menopause at certain age. Let's take it at around 50. After age 50, her bone health goes very down. Even during the young age when other people were building up their bone health, she was giving birth and a lot of leaching of calcium and important products happened from that body, which perhaps did not get replenished in enough quantities. So I think this combination of chelating away and not having enough store in the bank, she starts losing her bones as soon as she touches 50, and it happens very rapidly. It happens in men also, slowly, but men are about 10 years behind the women. So this is one aspect. Second aspect, you can make out that, the bones are formed under pressure, which means underweight. Ladies, girls are slightly underweight compared to the guys. So naturally, their bones are also weaker. They're also smaller. So naturally, they will have less store of calcium and important products of building blocks into them.
We have seen that female population are prone to D3 deficiency. What is the cause for this?
This is exactly what I was saying, that even if you look at a small household, it starts from there actually. You see, if you have a boy and a girl, the mother is always partial to the boy. You eat, you do this, you go out, you stay in the night, girl, you stay at home, you look after, learn how to cook, learn how to clean, you will be married off. It's always a second-class treatment in majority of households. Let's not say in every household. I think we in Bengal are very lucky that here the woman child is given a lot of importance.
Equal importance.
But in majority of states across India, this is so. Also, I think the girls don't go out much because then you may become dark. So they don't get enough vitamin D from environment as we were expecting. Also, their activities are mostly at home. You see, half the girls are housewives, so they don't get enough exposure where the guys have to go out to earn the livelihood. That's what the society demands. So this also helps the boys to generate more vitamin D. Moreover, their stocks in their bones are better because of being a boy. So I think all this will make sure that the girls are always deficit in vitamin D.
So from by what age these problems occur, sir? Generally, is there any particular age or age group or any
You
time?
want a surprising fact. Children as young as 5 are deficit in vitamin D. Dr. Marva in Delhi did a fantastic study across
to be noted,
across the schools. And it is not just in underprivileged schools. Even in high-class society schools, army boys were deficit of vitamin D. So I think this is a endemic and pandemic across India.
That's really, really terrifying, I would say. A lot of young population, youngsters are hitting the gym, actively participating in sports activities. So do you think, and we see that a lot of injuries are happening. So do you think that is increasing because of lack training or overtraining?
So one aspect is that people are hitting a gym, which is a good thing.
Which is absolutely a good thing.
Which is a good thing.
That is a good trend. I'm not denying the fact.
So naturally injuries will happen more. So if there are more people on the road, if they're driving, suppose, there will be more injuries on the road. So that is one natural consequence which is going to happen. If more people are playing sports, there'll be more sports injuries.
True.
This is a natural consequence. But I think even within that respect, if you look at it, we should have lesser injuries if they have been guiding properly. One important factor is people just go to the gym and start putting up weights. That's wrong. Do warm up. Do 10 minutes of warm up at least before you even hold one important aspect or one important kit of the gym. Then do a bit of running or walking, even if brisk walking, like a treadmill. Start with that.
Okay.
Do free hand. Start with this is whatever I say, doing free exercises. Then go onto the treadmill and then start doing lifting weights or stretching or, pulling things up. So that should come at the end. Also, I think don't try to compete. Look at somebody else who might be as a profession. That person might be a professional. You are maybe an IT professional who's just gone there to keep up your body. Don't look at him and start thinking I should also have a body like him. That's where I think majority of people are going wrong. When they start comparing and they start collaborating with them, that your need was different to that guy's need.
So all fitness freak people, I'm sure you are noting down what Dr. Rajput is saying. And next, what I would like to know from you, you are talking about the gym injuries. What kind of injuries generally happens?
So gym injuries, I'll tell you what happens. So if you do freehand, actually very few injuries happen.
Okay.
Moment you go on treadmill, particularly this older people like my age, first time hitting treadmill, want to go off at 7 because the other guy was at 7, speed 7. So I want to go at 7.
Okay.
Now he's got a good chance that he will trip. Right? So skidding injuries on treadmills are very high. Okay. Number 2, some people don't wear enough good shoe wear. So you have a very good footwear you need to have when you do treadmills. And do cardio. You don't need to put incline onto them in the beginning itself. Inclines are not good for normal people. Okay. It's only if you are practicing for something or highest level of training. For general training, don't put incline onto that. So treadmill is one place where injuries happen and people just bump off and fall. Number 2 areas where we see is when they lift weights. And when you lift weights, you get a lot of shoulder injuries. Like when you do lots of push-ups, pull-ups, and pull strings like rowing machines, you get elbow injuries, mainly your biceps, and sometimes you can have the inner flexor muscles which originate, and that's what and the outer muscles which can originate, which is called tennis elbows. Okay. And then you have wrist sprains and all that, and sometimes the DORJ injuries. Okay. So all these injuries will happen with a thing, and knee injuries are very common. When you do twisting and turning things in the gym, you can get your ACL injuries, you can get meniscal tears. And sometimes because of sometimes people are doing uneven exercises and they can sprain their ankles. So you just name an injury, it will happen. But the biggest injuries we see in gym are the back injuries. Okay. People lift weight and they sprain their back.
Okay.
So that's the biggest injuries we see in gym. Most of the people develop back injuries.
So how you take care at CMRI to take care of these injuries, to fix it?
Yeah. So main thing is education, that they should know that this is wrong with them. We do investigate these people and we find out if it's just a ligamentous injury or they've actually done to a disc. The disc will take longer to heal. The normal injuries will be healed within 6 weeks. Okay. So you just need a bit of comfort and that's it. Avoid gym for a certain time or do exercises which doesn't sprain your back, and then you can hit the gym back. What people actually ignore, one exercise which I tell everywhere is swimming. It's such a beautiful exercise, and the touch with water will give you a lot of extra hormones which get secreted in a swimming pool, which doesn't happen actually in a gym. It's one exercise we ignore. It's one exercise we should all do.
And it relaxes your mind as well, because I used to go for swimming and I used to feel very nice once I come from that. So next, what I want to know from you, sir, you always talk about future is robotics. Why you say that and why you believe that?
I think if you had asked me this question 5 years ago, I would have said yes. I think future is robotic. That future is here now. It's no more future. It's present.
It's present. Of course, it's present. But in coming time,
if you remember, Devrati, we were the first ones who brought robo in whole of East India.
True.
People were laughing at us that what's happened. Why have you brought this machine? I think it's the same thing when people brought in navigation to the driving.
True.
You know, sat nav when first came, people thinking, what's this box, idiot, stupid looking box sitting in your car? Do you not know how to drive? It wasn't meant to help you to drive. It was to take you where you want to go.
Right.
Of course, the technology there wasn't very good. But today, if you're going to an unknown place, tell me who will drive without a Google map?
That's absolutely.
Nobody will do it.
That's
so
absolutely.
today everybody uses that. So the technology has to evolve to make it such friendly, and in fact it becomes, I would say, compulsory rather than an association. It is compulsory now. So robotic is now compulsory. I think the only small drawback I can think with robo is that we still do not know exactly what we want. Once we know that what we want, robo will definitely take us there.
So don't mind if I ask you this. So robot will replace the doctors in future?
No,
Is
I
it going
don't
to
think.
happen
No,
that way?
robots will not replace the doctors, but there will be doctors with the robo and doctors without the robo, and the doctors with the robo will be performing much better than doctors without the robo.
Wow, that's amazing. So, but one thing I think I should ask you, since I know many people would like to know this, when we talk about advanced technology, the cost automatically comes. You know, people think that if we go for advanced treatment, then it can cost higher. And there are instances when insurance approval, there is also a gap. So what is your take on this? And what do you think how this gap can be filled?
So my take on this is that one has to pay for anything technology-wise. We never had MRI scans. You had only X-rays. You did treatment, but there was a gap. MRI came. Now nobody gets a treatment without an MRI scan. Agreed?
Right.
So there was a time when we did replacements. People were doing okay, but there were 20% people who were not happy. That's a big statistics. 1 in 5.
Okay.
So there was this lacuna which we were trying to, I would say, fill up. And I think the first thing which came in was navigation. Then came some handheld devices, and now the robo has come in. And all this is happening along with artificial intelligence also coming into this. So robo is only performing it. But now we need artificial intelligence that, okay, fine, your knee is different, his knee is different, that person's knee is different, mine is different. So what is good for me may not be good for you. And this is the information we are looking from artificial intelligence, because human mind will have a limitation to thinking process. It's like calculation. If I ask you what is 7 into 9, you'll be able to say. If I ask you 7 into 9 plus 12, you'll be able to say. But if I tell you 1244 into 36 into 44 into 36, you will give up.
Difficult, of
but
course.
If you look at a calculator, it will give you straight away.
True.
So, devices at some stage, when things get more and more complicated, the devices actually come into picture. So, the same thing is happening with replacement. We have understood that there are more things to a replacement than just putting in something into the human beings. It has to be put in certain angles. It has to be put in certain, degrees of flexion, some degree of extension, some degrees of lateral movement, some degree of medial movement, some amount of laxity, too much of calculations happening. I think in the end, I think we leave it to the machine to do it for us.
Wow, that's really amazing, sir. So, any message you would like to give to our viewers are watching you right now?
Yeah, I think
to take care of their
message I would tell your viewer is that you pick up a good doctor. That's more important. Whether he has a technology or not doesn't matter. He should be a good doctor, and good doctor doesn't mean only he is good at skills. He should have empathy, sympathy with his patients. So that's very important. If you feel that the doctor is not spending time with you, he's not even seen you, and he's meeting you straight away in operation theater, probably you're in the wrong hands. So you should discuss your problems with the doctor. Make sure he solved all your issues. Yes, the busiest doctors will have less time with you. They'll have a team. So at least one of the team members should be able to explain everything to you. And also, I think outcomes are very important. What I am doing, I should be able to find out what is happening. Suppose I do 50 patients operation. Did this operation work on us? Say it may be a good treatment for a guy in USA or a guy in Australia. Is it good for people like us? And we have realized that certain devices work very well in USA, doesn't work very well in India. So that is why we need to keep our own track of patients, what's happening to them. And that is why patients get irritated when they come back and we ask them a lot of questions, how you were, how you are, take them pictures from this side, take their walking videos. So they get very irritated when they've come back after, let's say, 6 months, and they're very happy, but still we are catching them and asking them all these questions. But they don't realize that they are actually contributing to the success of the operation. If patients 20 years ago did not agree to this, he would not be getting such a good operation now. And same thing 20 years down the line, I think the patients who will be getting their surgery should be doing it better than what these guys are doing.
That's fantastic, sir. And thank you so very much for joining us over here today. I'm sure our followers and viewers are going to gain a lot of awareness through this conversation. And thank you once again, sir.
Thank you.
And thanks to all of you for watching us. So I would say, take care of your bone, be healthy, and stay tuned to the podcast by CK Birla Hospitals, CMRI. ভালো থাকবেন, সুস্থ থাকবেন। নমস্কার।